means inflammation of the liver. Okay, so parang appendicitis, so inflammation of the appendix. So, ang hepatitis just means an inflammation of the liver. And there's a lot of causes of hepatitis. No? So, it can be infectious, which can be both bacterial and viral. So, hepatitis C is an example of a viral infection of the liver. So, it causes hepatitis and it causes hepatitis C infection. Okay? So, drugs can be a cause of hepatitis as well. So, sino ang nagagamot ng para sa cholesterol dito? So, we know yung mga statins na tinatawag natin, atorvastatin, simvastatin, no? So rosuvastatin. So, these are anti-cholesterol medication that can potentially cause inflammation of the liver. Okay? So, autoimmune, when the body is the one causing the inflammation of the liver, and alcohol, so can be a cause of hepatitis as well. So, but for this afternoon's purposes, so we'll be limiting ourselves to the discussion of the viral hepatitis. And there are a lot of viral hepatitis, and the infection that they cause is identified by the causative agent, and we refer to the virus by letters. So, hepatitis A virus causes hepatitis A infection, and hepatitis B virus causes hepatitis B infection. And hepatitis C, the hepatitis C virus causes the hepatitis C infection. And siguro yung dinidiscuss kanina ni Mr. Calleja, no, yung sinasabi niya nakukuha sa pagkain. No? So, that is an example of that is hepatitis A infection. But for our purposes this afternoon, so hepatitis B and hepatitis C, they have the same route of transmission, no, parenteral. So, but I've said, I'll be limiting my discussion sa hepatitis C infection. So, how big is the problem of hepatitis C globally? So, this is an old data, but you can see that the regional estimates of the number of patients with infected with the hepatitis C virus may be as low as 8.9 million in Europe and as high as 62.2 million in the Western Pacific. And it has been estimated by the World Health Organization that about 180 million individuals are currently infected with the hepatitis C virus. So unfortunately, we don't have a national seroprevalence data for in the Philippines, but we can extrapolate from this particular study in which they were able to do screening, no, for the hepatitis C virus among blood donors, OFW applicants, no, your medical and paramedical personnel, which we can say are the group of individuals with the less likelihood of having hepatitis C. So if you get an average of the incidence, or should I say the prevalence rate of positivity to the antibody for the hepatitis C, we can say that at least 1% of the general population is infected with the hepatitis C virus. So kaya doon ang galing yung 1%, and if we extrapolate that from the current population of the Philippines, which is about 105 million, so mga 1.05 million of the Filipinos are currently infected with the hepatitis C virus. So apart from that, no, so it was said that based on the WHO data, that 40% of the global mortality due to viral hepatitis occurs in the region where the Philippines is, no, the Western Pacific region. And based on genotypes, no, so medyo technical na yan. So we have several genotypes of hepatitis C, genotype 1 to 6. The most prevalent genotype in the Philippines is genotype 1. Okay? So before the advent of the DAAs, yun yung i-discuss nating treatment ngayon. So genotype 1 is the hardest to treat, no, during the pegylated interferon era. So, but now, so because of the effectiveness of the available medication, so whichever genotype you have, so the response to treatment is almost the same. No? Okay. So how do we transmit hepatitis C virus? No, so predominantly parenterally, and the routes. So when you receive transfusion from an infected individual, so if you receive blood transfusion, blood from an individual infected with hepatitis C, so IV drug use, particularly if you share needles. So needle stick injury, sexual contact, no, but the possibility of transmitting the virus sexually is much less compared to hepatitis B. So, and perinatal, so from mother to child. But again, compared to hepatitis B as well, the chance of getting an infected mother transmitting the virus to the baby is much less, about 4 to 6%. Okay. So, the main reason why I want to show this slide is that the hepatitis C virus is 10 times more infectious than HIV. Okay? So we all know that nowadays there's an increasing incidence and prevalence of HIV. And as you will see later, among HIV individuals, they should likewise be screened for hepatitis C because they are considered as also at a higher risk of getting the infection. Because hepatitis C and the HIV virus has the same route of transmission. Okay? So why do we care about hepatitis C infection? So sabi nga kanina, so a great majority of our patients with hepatitis C, when they get the infection, they don't show any symptoms. So the first phase of the infection is that you develop the acute infection. But clinically, you will not be able to say kung kailan na-infect yung individual kasi they don't feel anything. So, worse is that a great majority of those patients who gets infected with the hepatitis C virus develop chronic infection. So once you develop chronic infection, so how do we define chronic infection? Persistence of the virus for more than 6 months. And once you develop chronic infection, that's the time that the chance of that person to develop the complication associated with the infection increases. So what are the complications? Liver cirrhosis, o yung pagpebeklat ng atay, scarring of the liver. And if you develop liver cirrhosis, that's the main risk for the development of liver cancer. So the most dreaded complication of the hepatitis C infection is liver cirrhosis, and that patient can develop liver failure and then liver cancer. Okay, so that's the reason why we need to treat. So fortunately, even a great majority of patients who gets infected with the hepatitis C virus, so only a small proportion of these patients develop cirrhosis, about 10 to 15% of the 60 to 85%. And they develop cirrhosis over a period of 20 to 25 years. Okay, and only 2 to 4% of those cirrhotic patients will develop liver cancer at a rate of 2 to 4% on an annual basis. So what are the common symptoms associated? So when you ask an individual with hepatitis C, ano ba yung usual niyang nire-report? Okay, so what do you notice? So there's fatigue, impaired cognitive function, parang tayo lang minsan, di ba, pagpuyat. Diba? But it doesn't mean that you have hepatitis C. Okay, so most of the symptoms that the patient reports significantly overlap with some of the other medical conditions of the patient. So, meaning, the symptoms are not specific for hepatitis C. Okay? So, walang magsasabi dyan na simptomas na ikaw ay may hepatitis C. So, magsasabi lang that you have the hepatitis C if you get tested and you turn out to be positive for the screening test. Okay. So, again, just to reiterate, a great majority of patients with hepatitis C are asymptomatic, more than 50% of them. And in those patients who report symptoms, 37% of the total population with hepatitis C infection, 80% of them would report easy fatigability as the most common symptom. Okay? Parang tayo nga lang. Palaging pagod. Okay. So who needs to be screened for hepatitis C? So unlike hepatitis B, if you live in a country wherein it is highly prevalent, then general screening of the population is a very cost-effective way of finding the one who is infected. But for hepatitis C, you need to only screen those with risk factors. That is based on their behaviors and exposure. Okay? So what do I mean by that? So these are the subgroups of patients in which recommended both by the American Association for the Study of Liver Disease and the United States Public Health Service. So recent or past injection drug user, kahit isang beses lang sila nagturok, they need to be screened. And then groups with high hepatitis C prevalence, those, as I've said, HIV-infected individuals. So hemophilia treated with clotting factor concentrate, but this one does not apply to the Philippines. So, we started screening only our blood, no, for hepatitis C. Kasi sino namang nag-donate ng blood dito? Diba? Ini-screen for hepatitis B and hepatitis C. So, it was only made into law, no, in 1994. But the actual implementation of screening blood for hepatitis C started only in 1995. So, if you receive transfusion earlier than 1995, then you need to be screened for hepatitis C as well. Okay? So, hemodialysis recipients, no, so kasi sila yung nagre-receive ng blood transfusion so often. Can patients with unexplained aminotransferase, ano ba yan? I'm pretty sure sa mga nag-general check-up dito, you've heard about SGPT and SGOT or ALT or AST. So, if you have persistent elevation of your both transaminases, or particularly ALT, and your doctor cannot, there's no other reason to explain that, then you need to be screened for hepatitis C as well. Particularly if you have unknown exposure or unknown high-risk behavior. Okay? What else? No, so recipient of transfusion or transplantation before 1992. So again, sa atin hindi rin nag-a-apply. So 1995 tayo. Children born to women infected with the hepatitis C virus. As I've said, the chances of a infected mother transmitting it to the baby is far less compared to hepatitis B. It's about 4 to 6%. And then healthcare, public safety, emergency medical personnel, so those who work in the medical care setting, current sexual partners of individuals infected with the hepatitis C virus, and persons who have used illicit drugs by non-injection routes. Okay, how do we diagnose? So this is the recommended testing sequence. So the screening test that we use is the antibody to the hepatitis C virus. Yung tinatawag natin anti-HCV. So if you turn out to be positive to the hepatitis C virus, it doesn't mean that you're currently infected. Ang ibig sabihin lang, you were exposed to the virus either before or prior exposure and you're cured already, or you're currently infected. So how do we differentiate one from the other? We need a test to determine the actual viral count, meaning yung actual number of virus in your blood. So that's what we call the HCV RNA test. So if you turn any values, no, so of your HCV RNA, if you turn out, for example, 1 million, then it just means that you're currently infected with the hepatitis C virus. But if it's undetectable, no, ibig sabihin nun, you were exposed before and you're now cured. Okay, so the antibodies to the hepatitis C virus does not go away. So pag kahit nagamot ka na, if you test yourself again, you will be positive to the antibodies. Kasi it's an antibody. It is a substance, no, or a substance that your body produces in response to an infection. Kaya hindi yun mawawala. But it does not mean that you're still infected, particularly kung naggamot ka. Okay? To reiterate, we diagnose chronic hepatitis C infection. Why important again? Because once you develop chronicity of the infection, that's the time that you develop the complication. Again, liver cirrhosis and liver cancer. So we will be able to say that a patient has chronic infection if both your anti-HCV or antibody to the hepatitis C virus and a detectable HCV RNA. So a combination of a combination of that two information. So in summary, first, if you want to screen a person for the hepatitis C infection, so you test that person for the antibodies for the hepatitis C virus. And then if a person turns out to be positive for this test, then you need to do the second test. That is the HCV RNA. Again, if the HCV RNA is detectable, then that means that the patient is currently infected.